A lot of times people talk about peptides and exosomes. Both of these are cellular signalers, but exosomes work, well, they are different and they work a little differently.
Well, very different. These are packages of information. They contain, well, they're membrane bound, so they're little vesicles about the size of a virus, so they travel between cells and into cells very easily. And inside, it's not just one message, there's multiple messages. There's peptides inside, there's DNA, there's RNA, even what are called microRNAs, which are similar to peptides, very small pieces, in this case of nucleic acid material, that can go from the brain to other tissues, from tissues back up to the brain. And this is essentially the way the body can coordinate. So if there's an injury on your hand, your brain will know. Or if your brain gets injured, the rest of your body knows. And you need to have these messengers to coordinate the system in the same way you could imagine that the US Post. And so these are little mail deliveries or cargoes that we can both intercept and read. Perhaps we can use these to diagnose diseases, including cancer, but also we can make more of them and infuse them into people to give a false alarm, perhaps even to simulate this adversity and make us live longer.
And before we get to those therapeutic processes, one of the really fast-moving avenues for using exosomes is basically collecting them from the blood, counting them up, and being able to diagnose different injuries. And even like you can pull from people's blood these exosomes, and then you can say like, oh, they have an injury here, they have a disease there.
Right. Yeah, there are companies now that, there's one called Czar Therapeutics, there are others that you can read the cargo and you can say, okay, that comes from the pancreas, that is the signature of a stage 3 pancreatic cancer. So we may be able to use these to diagnose cancer years in advance.
Without biopsying.
Right, just a blood test or even a finger prick at home, send it off and diagnose cancer.
And that would be reason enough to be excited, I think, about the potential for exosomes to tell us what's going on in our bodies. But what else we're learning right now about exosomes is that if we supplement these into the bodies of mice, like by injecting them back into their bloodstreams, it can help with injury.
Yeah, I mean, there's a really well-known paper now from August 2017 by my good colleague down at Albert Einstein College of Medicine, Dongsheng Kai. And his expertise is looking how the hypothalamus, the little organ at the base of the brain, communicates to the rest of the body. And he's found that inflammation and damage to that part of the body affects the rest of the animal, including aging. And in this case, he found, interestingly, that neuronal stem cells, these progenitors in the hypothalamus, they secrete exosomes that tell the body to hunker down and survive, and the mouse can actually live longer if you isolate these exosomes and give it to the mouse. They also did the opposite. They deleted these special cells that make the exosomes, and the mice got diseases of aging and lived shorter.
Why is that happening?
Well, we don't know. In most cases, there's so many things within the exosomes that it's very hard to figure out which of those particular cargoes is responsible for the biological effect. But ultimately, if we can figure that out, we could make exosomes with just that particular component, and that could be a drug in the future.
There was another fairly recent paper on exosomes, a 2019 paper from some Chinese researchers that used exosome replacement to address ulcer healing. And what they concluded was that the exosomes were actually rejuvenating senescent cells. Really fascinating here.
Well, so senescent cells, if you missed the previous episode, are cells that as they get old and they have X differentiation, they lose their ability to read their DNA correctly. They become senescent. They stop dividing. They sit there and they start secreting inflammatory molecules, can even cause cancer to develop. We try to delete these cells. We know that in a mouse and probably in a human, if you get rid of these inflammatory senescent cells, it's good for health. But here we're saying, what the researchers are saying is that these exosomes, the particular type of exosomes, can reverse senescence. That's unheard of. If that turns out to be true, that would be quite a remarkable thing, meaning one day we don't have to kill off these cells, which, in the brain you wouldn't want to do that necessarily. We could actually rejuvenate them and get them to grow again healthily.
Right now, the way we understand how to do that is through the Yamanaka factors. But this would be another avenue toward that same goal of taking X-differentiated cells and sending them back into a differentiated state.
Well, the Yamanaka factor rejuvenation of senescent cells is preliminary. This is some of the work we're doing in my lab. And it's not even clear if the Yamanaka factors are potent enough to reverse senescence. But this finding that you referred to is the first instance that might be possible.
all of this is why there's a lot of excitement around this this particular potential therapy. But again, just like peptides, this is sort of the Wild West right now. But people are already taking exosomes and having them shot into their bodies.
They can be delivered by IV or intramuscularly. But again, we don't know what the long-term benefits or side effects are. So we have to be careful. It's still available in some parts of the US, but we don't know.
Yeah, this is not one of those things you have to go to Costa Rica for. At least as of right now, the FDA hasn't cracked down. They haven't said this is a step too far.
That's right. But well, while exosomes aren't completely banned in the United States, you can bet that the FDA is looking at this for potential safety concerns, and we'll see how things go over the next few years.
And that's not the same thing as saying, like, go do it now.
No, that's not what we're here for. We want to educate and look at what might be available down the line once things are proven to be safe and effective.
And this is another one of those things, like peptides, you're feeling positive that there is going to be actual clinical research that will show us the actual benefits of these. We don't have to make super guesses. We can actually see in the research how exosomes are going to be beneficial and then start to implement them into our longevity regimes in a responsible way.
That's right. And just to be clear, exosomes are a highly validated scientific pursuit. And there are biotech companies, pharmaceutical companies, building giant factories for billions of dollars to make exosomes to treat diseases. The question is, do they work for long-term health and longevity, and how safe they are to be used over decades? That we don't know yet.